Welcome back to Mountain Health Today. I'm Ted Owens, your host, talking with Harry Weiss, President and CEO of the Tahoe Forest Health System. Harry, we've been talking about the growth of the health system over the past 10 years and how it was enabled by the community through a general obligation bond, which was in addition to their property tax increment that they pay for the health system. What's amazing to me is the growth. So a forecast of growth was made over the next decade at that time. And here we are, 12 years later, very fortunate that the community had made those choices. Right. Let's talk a little bit about the growth that has happened over that period of time, more specifically the last 4 years, so that we can have a discussion about the future.
Sure.
In the last 4 or 5 years, how has the system grown?
Just in the last 4 years, about 65% overall system growth. So this isn't in one area. This is broad spectrum growth across all modalities of our health system. And then if we look, we're halfway through fiscal year 20, we're seeing in the 12 to 14% growth rate again over the 65% growth from 15 to 19.
So, but to be clear, we're not talking necessarily about, revenue growth. You're talking about patient visits.
All types of patient touches, and only one example of that would be that physician, nurse practitioner, and physician assistant office visits were about 46,015, and right now they're extrapolating into the 88,000 to 89,000 range per year.
And this is in part because the system could capacitate it. Right. The community saw the needs, but also the community's changed.
Right.
Next year is the census. We'll know more in a couple of years, but are you seeing a population that is requiring access to the health system increase?
Absolutely, and we'll have other programs that clarify this more, but even though we've made many provider ads, we're still actually backlogged, in some of these areas as well. But
so you keep growing, right? The line continues to.
The special journey that we're on, that's a love journey with our community, is we really want to keep our population well, and we want to keep them out of the emergency department and out of our inpatient beds to the maximum degree possible. And so we've put in place tools to do that, and you're going to hear more about that and other programs. But that is the right thing to do, is whether it's a physical health or a mental health access, we want it to be the most efficient and the lowest cost setting. And we're also really demonstrating the lowest number of admissions or discharges per thousand population of any region that I know of in California or Nevada as well, which I think also saves our community, those payers of healthcare dollars, over $20 million a year.
So you've really exercised a great deal of leadership, what I would call great respect for the taxpayer's dollar.
Right.
And even so with the general obligation bonds. Over time, share with us how you have seized opportunity in the marketplace to the benefit of the taxpayer.
I think we did the correct thing to save dollars right up front, in that we didn't borrow all of the monies in one single bond issue. They were done in 3 segments. So that saved dollars up front. And then most importantly, as we've seen market improvement opportunities, we have now refinanced all 3 segments again with really optimal fixed interest rate, lower interest rate obligations. We didn't enlarge the size of the bonds. We didn't extend the payoff date. We kept all those fixed so that everything matures no later than 2040. But we've been able to save over this residual roughly 20-year period. It's going to produce actual hard dollar savings of about $20.4 million to all of our taxpayers on this GO bond issue.
That is a lot of money. And they will see that on their tax bill.
That is correct.
That's the amount that's charged per 100,000 of assessed value on the property that they own.
That is correct.
and that's the figure that has been refinanced, seizing lower interest rates and bringing it down. And then you said you've locked it in long term, so it's not a rate that will fluctuate in the future.
Absolutely.
And that was a problem with the recession. When Prop 8 was enacted, property values were dropping, but the funding requirements of the GO bond were still required.
Right.
So this would prevent a situation like that occurring in the future.
Yeah, it creates the most optimal 20-year path ahead from 2020 to 2040.
So that's where we've been. We've got a little bit of time left to talk about what you're seeing in the future. You're growing at a rapid rate.
Well,
What's out there?
a critical part of our master plan is to continue to open up capacity so that patients can have timely access to care. And so some of our community has observed, most likely, that we have a new pediatric space on the 3rd floor of our medical office building that's really very beautiful. We also have a new beautiful space on the 2nd floor of the cancer center that's multi-specialty, very beautiful as well, that has really increased access. It is going to allow us to renovate other areas for increased capacity as well. We also added new state-of-the-art mammography equipment too that's been wildly accepted.
So you've done a lot, but one thing I want to point out before we leave is those things were not done with the general obligation bonds.
Absolutely.
You've been watching Mountain Health Today. I'm Ted Owens. Our guest has been Harry Weiss, President and CEO of the Tahoe Forest Health System. Harry, thank you for being with us, and thanks for watching. Welcome back to Mountain Health Today. I'm Ted Owens, your host. We're talking with Harry Weiss, President and CEO of the Tahoe Forest Health System. We're talking a little bit of the history of kind of a period of growth for the health system over the past decade through the general obligation bond passed in '07. Harry, we were talking about a little bit of the process I want to go back to that the hospital went through, the health system went through, of community involvement. So they had a seismic, which is not a sexy thing, compliance issue that could determine whether healthcare was there or not. And then great community involvement and determination of desired services. Tell me a little bit about the approach the district took to get the community involved with their hospital.
I think they really put together a team that was definitely community connected, that was hearing the community, gathering information from the community as to early on, what are those critical needs and what is the size that might be palatable as well. And so I think they really obtained what appears to be great clarity as to, yes, we want a hospital long term. We want that guarantee to the degree possible. Healthcare is always going to be here. We respect that seismic issues have changed. We also recognize that certain programs need to be improved or expanded, and those are very important to us. Quality emergency room services, a new obstetrical, women's health and children's
Let's
program.
go back to the ER. There were ER services, emergency services before. But that was an older environment.
Older, smaller, didn't necessarily have the smooth workflow that was needed and would have the capacity that was needed as our community is growing and as guests are growing, and we need to be able to accommodate greater numbers of ER visits.
Okay, now in newborn health, for example, it's a legacy service.
Absolutely.
For the district. And was that the same case there, that that was completely
It was
as well.
really aging, and it was not in compliant space, so nobody wanted to lose obstetrical services. So we need a new physical plant to do that for the moms and the babies. And we have an amazing, beautiful physical plant now with the laboring rooms and the post-delivery and a cesarean section room and so forth. That's very friendly, very comforting, and so that quality service has been preserved with a new physical plant.
Also, I believe identified were needed improvements in the long-term care facility as well.
Absolutely. The long-term extended care facility has been viewed as a very valuable asset. It is the long-term residence for many of our older patients who need around-the-clock great care, and they really appreciate the quality of care given there. It needed some upgrades and improvements, and those were really appreciated as well.
And here we are, a decade later, you could be doubling its size.
Absolutely.
If the need is there. Also, in addition to some of those items, there was the Cancer Center we've talked about in previous programs.
Right.
But that was also part of the ask to the public.
That's right. There was a recognition that the care for cancer care to have to go to the Bay Area, to go to other distant communities was not acceptable. The volume of cases was significant, and so there was a real groundswell that we really want to see a comprehensive cancer center right here in Truckee.
So I've asked you this question before, but in your experience across the United States in healthcare, have you seen a community come together before like that, both to save a hospital but also to identify future services and needs, and then be willing to fund it?
I think the clarity, the enthusiasm, and the resulting actions of 72% of the population is as strong as I have seen anywhere. And the quality of service, that they really wanted in this rural community was astounding as well.
They created a quality environment.
Right.
And we'll talk a little bit later about filling it with quality professionals.
Right.
So it's an environment as well as the team approach. A general obligation bond, I want to come back to a little bit more in detail, the methodology of that it was funded by, some of the respectful measures that have been taken over time, the time of the bonds and refinancing in the next segment. I'd like to go there.
Sure.
It's a little deep for right now, but share with me, we're a decade later, the community recognized a need for growth and to become compliant, and yet you're looking down the barrel of more need, more population, and more growth.
Absolutely.
What do you see?
What we've experienced just in the last 4 years, in the 4 years into June 30, 19, this might surprise some of our viewing audience, our health system has grown over 65%. And that is, it's broad-based growth as we've been focused on filling those gaps of critical unmet healthcare needs in our communities. So that has really driven us to develop a master plan and a strategic plan to really begin to thoughtfully plan for the next 10 to 15 years out into the future.
Yeah, it's kind of amazing when you stop to consider that looking out 10 years seems like a great distance, and it's already passed quickly, and we're going to do it again. You're watching Mountain Health Today. I'm Ted Owens, talking with Harry Weiss, CEO and President, Tahoe Forest Health System. We'll be back in just a moment. You're watching Mountain Health Today. I'm Ted Owens, your host. My guest today is Harry Weiss, President and CEO of the Tahoe Forest Health System. And we're going to talk, Harry, a little bit about the growth of the health system, primarily driven originally by Senate Bill 1953, which was a seismic regulation, which came out of the Northridge earthquake years ago. So that affected a lot of hospitals in California. Share with us a little bit about that background.
Right. Hospitals have significant seismic structural improvements that they must complete prior to 2030. Tahoe Forest Health System was not immune and faced that issue, so it became very proactive back in the early 2000s, really evaluated various capital needs, did a community assessment, and really set forth to put in place a general obligation bond partnering with our community as a special hospital or healthcare district to really see if the public could get behind critical needs to really preserve and to lead this health system forward for many decades into the future.
It really was a forked spear, though, effort, because many of the buildings were built, some as early as 1950, 66, through the 70s and early 80s, and they were all non-compliant. So part of the question was to the public, do you want a hospital?
Right.
Because if it didn't comply, it wouldn't be there.
Right. It would have to sunset and healthcare would cease to exist at a certain date if it doesn't meet those seismic criteria.
And so to your point, though, so there was a critical need.
Absolutely.
And then the other element of that was, we're going to have to do this. We're going to have to do it with the public support through a general obligation bond.
Correct.
But in addition to that, how do we plan and grow for the future?
Right.
And there was a methodology set forth to reach out to the public.
Right.
I think this was a bond measure that went in 2007.
Correct.
And based on a lot of input from the public, you knew what kind of services did the public seek at that time?
They were basically looking for, as the ballot measure talked about, is within reason a full-service rural hospital that included services like obstetrics, cancer, and so forth that might not all be typical in a rural facility. So there was an educational component. The community really got behind it once they understood what the issues were. It was sized at roughly $98.5 million. The topics were all viewed as vitally important, and that would be really illustrated by a yes vote of 72% of the registered voters within the district, a very strong supermajority, clear voice as to what they want to see.
And now on a general obligation bond, you have to meet at least the threshold of 2/3.
Correct.
Supermajority, so the community supported even beyond that.
Right. So they said we want to see a quality rural health system going forward. And oh, by the way, here's $98.5 million over the next 30 years, which would be roughly 2010 through 2040 through a tax-exempt bond measure that taxpayers would kindly support Tahoe Forest Health System.
So it was a very risky ask. It was a big ask, too. Right. You're asking to improve infrastructure. Right. Now, the Tahoe Forest Hospital District is a political subdivision of the state of California created by legislation in the 40s. In the 40s for rural areas primarily. Right. So there's a property tax component that the district received, but it has, just by the nature of the changes in healthcare, diminished over time. Correct. In terms of percentage of revenue.
We're very grateful for that partnering by taxpayers, but just to put it in perspective, it today, all components probably are less than 5% of the operating revenues of the health system, so that's very different than many other types of districts, but we certainly appreciate that partnering, and I think as we've shared in letters in the distant past, our community, there's at least a 10-to-1 return, on the dollars that are gratefully received from our taxpayers as well.
But the challenge in the ask was, people see it on their property tax statement every year. Right. And then with the general obligation bond, the ask is really to continue to support in addition to that.
Correct.
The organization compliance, so its existence, and then its future growth.
And I think the thing that's hopefully been exciting to our community is, not everything is exciting, but it certainly took care of central plant improvements, which were critical. It took care of seismic issues through many areas of our organization. It really helped with our emergency department really create a much more effective state-of-the-art emergency department. It also really was a major impetus for our cancer center, that coupled with philanthropy. Also the Joseph Family Center for Women and Newborn Care, which is beloved by young families in our community, and also great improvements to our extended care facility, which takes care of typically more of the elderly, but it can be non-elderly as well for a long-term, high-quality residential setting.
I'd like to explore some of those services that came about or were enhanced as a result of the general bond when we come back in just a moment. You're watching Mountain Health Today. I'm Ted Owens, sitting with Harry Weiss, and we'll be back with you in just a moment. Welcome to Mountain Health Today. I'm Ted Owens, your host. Mountain Health Today is a program, all things healthcare, of great importance to the community that we serve. You can watch us on Lake Tahoe TV, in Truckee on Channel 14, North Lake Tahoe Channel 195, South Lake Tahoe Channel 12, and of course, you can always watch these programs on tfhd.com. We'll be back in just a moment.